When a person dies, a number of steps need to be completed to allow legal registration of the death and for a funeral to take place. The first is the verification of the death. This is sometimes known as recognition of life extinct, or pronouncing death, or declaration of death. The process of verification of death is defined as deciding whether a patient is actually deceased. It does not necessarily require a medical practitioner to undertake this verification. For example, there are certain nursing staff and certain ambulance staff that can also undertake the verification. However, it is necessary for a medical practitioner to undertake the certification of death. The guidance in this video is taken from the Oxford Handbook for the Foundation Programme. The first step when declaring death is to ensure that you have identified that you have got the correct patient by using patient identifiers. After this, you should check for any reaction to voice and pain. This is done by undertaking a sternal rub or pressure on the supraorbital nerve. The next step is to check for pupillary reflexes. Pupils will be fixed and often dilated. Often they will also have a dry appearance as well. Next, assess for absence of a central pulse for 1 minute. This can either be a carotid or femoral pulse. After assessing absence of a pulse, move on to assess for absence of heart sounds for 1 minute through auscultation. After this, assess for respiratory effort and sounds by listening to both sides of the chest for 30 seconds each using your stethoscope. Do bear in mind you might still hear gastrointestinal sounds. Don't confuse these for respiratory sounds. It is also helpful to note if there is a pacemaker present in the patient, and then you need to make a written documentation of the declaration of death. This should be timed and dated in the notes and should contain the following information: that there is no response to pain, that the pupils are fixed and dilated, and that there is no carotid pulse, no audible heart sounds, and no audible breath sounds for 60 seconds each. You should then make a statement that declares the death has occurred at a particular time on that particular date, and it's also useful to note whether there is a pacemaker palpable or not. Finally, sign the entry with your full name, signature, designation, and contact number or contact bleep. The next step, of course, is then to decide whether this patient needs referral to the coroner, and there will be further education on this subject at another time in your medical training. It's also, of course, important to ensure that you speak to the family and inform other members of the medical team and nursing team of the patient's death.